This has been a real struggle for our country for a long time now, and it's been getting worse. Recognizing the extent of this problem, seeing both the numbers, the fact that this epidemic has grown dramatically, seeing that we lose 91 people, every day to overdose deaths, seeing how this is devastating small and big communities all across America. This is part of what has driven me to address this epidemic during my tenure.
I was thinking back 9 years ago. It was a February morning in upstate New York, so it was cold and snowy, and a 19-year-old version of me was sitting in the driver's seat of my little car, and I was getting ready to inject the last of my heroin and cocaine. I was using both because I was so addicted to heroin and no longer got me high. It just kept me from being sick, and the cocaine gave me a little bit of a buzz. And I was going to smoke my last cigarette, and I had resigned to the idea that I was going to overdose that night in my car and die, and that was a better option for me than living the life that I was living. I created this facade in my life of I was an overachiever. I played varsity sports. I was an honors student, and if I could convince the rest of the world that I was fine and normal like them, then maybe I would be.
We also have a misconception that it's a couple weeks or maybe a month in treatment and then you're cured. And addiction does not work like that. This is a long-term condition. This is a chronic illness. And what that means is that people often will need help for months or years.
Never in a million years did I ever think that I would do that drug. Like, it was one thing to use a harmless pill, but it was something that I would never do, was that drug. But when you are sick, when you are experiencing withdrawal, you will do whatever you have to do to just not feel that way. So the easiest thing when you're suffering and you're sick and you're hurting emotionally or physically, and you know that a pill or one little thing that you can get will make it all go away in an instant, that's really hard to say no to.
One of the ways that we eradicate stigma is we tell the stories of people who are struggling with addiction so that people can understand that these people are not the other, but these are, in fact, us. That these are people that we know, that we relate to, and we ourselves may have even struggled in the past. But they allow people to come out of the shadows, and that's what we have to do.
We have a really great opportunity with the writers and the producers to even tell that story, that it's possible. No matter how far down you are, you can recover, and people are doing it, and you can do it too. I mean, just hearing that message, I wish I had heard it sooner.
And one of the things that I had seen recovery in movies, it was always sort of like you watch a 2-hour movie about a character that's going through all these challenges, and then at the very end of the 2 hours, they get sober, and then credits, like that's it, done, happy ending. And I think for so many people, getting into recovery is the beginning of the story, and we wanted to start the story there.
This is ultimately about whether or not we as a society want to live by a fundamental value, a value that states that every life does in fact matter. And if we believe that, then we have to reflect that in our language, we have to reflect that in the services that we offer people who are in need, and in the community that we build for them that will catch them when they fall, but also accept them when they come back and when they're in recovery.
We set out to tell a story about redemption and about hope, and we set out to make people laugh. So if it in any way has helped people or reduced stigma, that's wonderful.
When I talk to folks around the country, young people in particular, it's very clear to me that they take their cues from these characters that they like. And if that character is using unhealthy tools of dealing with stress, whether it's alcohol or drugs or violence, then that somehow gives that tacit approval, even though that may not be our basic intention. The flip is that if we can actually help people through media see that there are healthy ways of dealing with stress, then that would be powerful. And what are these? Well, so social connection is powerful, exercise is powerful, contemplative practices like meditation and gratitude exercise is incredibly powerful. What we can do with your help is to demystify these, to take these out of the realm of superstition and into the realm of science, and help people see that these are healthy ways that we can deal with stress, we can improve our health, and ultimately improve our lives.